Hello, this is Dr. Gay from First Look MRI, and this is a 44-year-old gentleman who complains of anterior knee pain for about 27 years. It began when he was around 11 years old and continues to this day. So he finally came in for an MRI scan, and we can see very clearly on this sagittal PD fat sat view. This is a protein density view without fat sat, and this is a protein density view with fat saturation. So all the fat in the marrow space here and the subcutaneous soft tissues is now dark, and the thing that really jumps out is the inflammation surrounding this proximal patellar tendon. And just for some anatomy, this is the femur, this is the tibia, this is the kneecap or patella. We have the quadriceps tendon up here looking completely normal, nice and uniform and low in signal. And we see the patellar tendon along the side looking pretty good, but centrally it is thick, irritated, has bright signal, so some micro tearing centrally. And we see this thick rind of inflammation or granulation tissue or edema all around that. So we know this is acute upon chronic inflammation. And in an adult or older person, we call this jumper's knee. So sometimes people play basketball or do other things, and they'll have chronic traction of the patellar tendon along the lower pole of the kneecap where it attaches. And they can have edema and inflammation and partial tearing right here. When children get this during development, the growth plate along the bottom can become irritated, and rarely it will not fuse with the bottom, and I believe this is a case of that. We call that Sinding-Larson-Johansson Syndrome, when they have chronic irritation of the bottom of the kneecap where the growth plate is. And if they rest, usually the little piece will become incorporated with maturity and become part of the kneecap. Rarely, as in this case, the little piece of bone here did not become incorporated. We see it looks like almost like a puzzle piece, a piece here that should fit right here. So this is chronic irritation, probably during development, way back when he was 11 years old and started having the symptoms, and he just never let it heal and incorporate. So this is a little fragment that's hanging off the bottom, and he has micro tearing and inflammation there centrally, and this rind of edema around it. So this is a case of patellar tendinopathy with prominent edema and inflammation and a little unfused ossification. Again, if we saw a young child with this during development, we call it Sinding-Larson-Johansson Syndrome. And nowadays we call it jumper's knee, now that he's undergone skeletal maturity. And again, it probably was started as the Sinding-Larson-Johansson Syndrome and just never went on to heal like it typically does. And that's it. Thank you very much.